Hi, my name is Regan Holmes, and I'm going to be presenting on the status of the HIV and AIDS epidemic as it's being managed in Utah. I chose this topic because I'm from an area of Utah where people generally have a higher risk of transmission of HIV because of drug use and sexual contact. So I was just curious to see how it was being handled out here. So just a little background, HIV is a retrovirus that infects humans. Infection with HIV is progressive if untreated, and AIDS results when the infection reaches a certain stage in its host. Continuous destruction of the immune system renders those infected particularly susceptible to infections and cancers, and they often die from common pathogens. So this slide shows Utah's rates of HIV diagnosis over the last decade in comparison to the rates of diagnosis in the United States. As you can see, these trends are generally pretty stable, though Utah experienced a slight increase while the US rates of diagnosis decreased slightly over the last couple of years. And in this chart, we see the breakdown of HIV diagnosis by race or ethnicity and by gender in Utah in 2019. As you can see, HIV disproportionately affects Black people far more than any other group in the state. It's important to note that HIV affects a very, very small fraction of Utahns, but Black people make up most of that fraction. So this slide shows a breakdown of the HIV infections by county in Utah. The highest rate, as you can see, is Salt Lake County. This county especially has high numbers of transient and homeless people and higher drug use than the other counties in Utah. The counties with higher HIV transmission also have higher rates of poverty than others. So these charts show the most frequent ways in which HIV is transmitted in Utah. For males, male-to-male sexual contact is the most prolific method of transmission, and for females, it is heterosexual contact. Other less common methods are through injection via used needles in medical transplants or blood transfusions, and a combination of any of these factors also increases risk. These are all factors that increase a person's risk of HIV transmission. These include unprotected sex, STDs, especially STDs that cause sores in a person's genital areas, high viral load, substance use, especially when someone is sharing needles, douching, and a person having multiple sexual partners. So when a person gets an HIV infection, they can have symptoms which include fever, chills, headaches, night sweats, sore throat, muscle aches and pains, joint pain, fatigue, swollen lymph nodes, and mouth ulcers. But many people don't have symptoms, so that's why HIV is hard to detect in the early stages. So when HIV progresses to AIDS, that means it has targeted your immune system, and your immune system is no longer able to fight common pathogens and infections or diseases that it normally should because your T lymphocytes have been destroyed. So this makes people who have AIDS particularly susceptible to pneumonias and cancers. So AIDS was first clinically observed in the United States in 1981 when groups of gay men and drug users were developing the same rare cancers and infections. These infections began spreading quickly, and over time, people with HIV were found to be dying of normally non-serious or rare illnesses as their immune systems were decimated. So there's been a big focus in the medical community on finding a cure or something to prevent progression of HIV and AIDS. These include long-term non-progressors, vaccines or cures, microbicides for STDs, stem cell cures, bone marrow transplants, and immunomodulatory agents. So right now the most effective treatment for HIV is called antiretroviral therapy. The main goal of HIV treatment is to reduce a person's viral load to an undetectable level, meaning that they don't show up in a blood test. People who have an undetectable level of HIV have no risk of transmitting it. So this graph shows just how effective ART has been in preventing deaths due to HIV and AIDS. The red part of this chart shows the predicted deaths averted, and the blue part is actual deaths due to HIV and AIDS. So as you can see, it's been very effective since it became the common treatment for HIV. So the person in this photo is named Ryan White. When he was 13, he received a blood transfusion from a person that was infected with HIV, and he developed AIDS. During the time he was infected, though, he petitioned for legislation to prevent discrimination of all people infected with HIV or AIDS so that they could live normal lives. So, as you can see, because of Ryan White, there are many programs and resources devoted specifically to people who have HIV and AIDS, including in our great state of Utah. The University of Utah has a Ryan White program where they provide treatment and care and link people up with specialists and other resources to manage their disease. So, I'm going to use the rest of this presentation to focus on some resources that we have in Utah. Um, so these are all dedicated to either treating AIDS and HIV or preventing AIDS or HIV in those who are at risk of transmitting or receiving it. So these are some of the organizations and services involved in the HIV and prevention and treatment task force that we have in Utah. So we've got some departments of health, we've got universities, volunteer services, some counseling centers, and there are some other organizations not listed too. All right, and this was something I found interesting. So this is a list of college wellness centers in Utah that offer HIV testing. So as you can see, BYU, the University of Utah, and Dixie State University all offer HIV tests, but Weber State University and Utah State do not. So that is something I think that they can change. And then this was a flyer I found. So a few weeks ago, they had a Utah Sexual Health Summit for all clinical providers. And this is focused on preventing STDs and treating diseases like HIV. So that was, I think, a really big thing that happened in Utah, and it was really important. So to conclude this presentation, I think it's important for all of us to understand as future public health professionals just how important it is to find ways to curb the HIV and AIDS epidemic and to also find ways to prevent transmission and death from these diseases.